So speaking of that, that brings in, I know it is not part of the questionnaire here. So I want you to, many times when we have a husband and a wife, for example,
Mm-hmm.
right? So the wife came as wife came as a patient. The husband is not a patient, but many times we recommend about the mouth body
Mm-hmm.
connection and the kissing link,
Uh-huh.
right? So do you want to do you want to tell them? Let's say let's say my wife came as a patient and
Mm-hmm.
I was the husband. I came with with my wife. So tell me, what are you going to explain? How it is critical for me to get a consultation also? What are you going to
Okay.
tell my wife?
Well, I would tell your wife that for, if you could see this, I don't know if you could see this very well, but for a healthy tooth, the gums are nice and pink and tight against the tooth, and so is the bone, as you can see in this picture right here. And then when you have an unhealthy tooth and there's bacteria and infection in your mouth, the gums are more red and puffy, and the bone is not as tight up against the tooth. That is an infection in your mouth. And when you have that infection in your mouth, it doesn't just stay in your mouth. It gets into your carotid artery and it goes to your heart, your lungs, your liver, your pancreas, your brain. For women, it can cause pregnancy complications, stillbirths, low birth weights, and other pregnancy complications. And then for men, it can cause erectile dysfunction. And it's not only something that affects you in your own mouth and in your own body, but you can transmit this to your spouse, your children, anyone that you are kissing, anyone that you are sharing utensils with, or even just coughing and sneezing around them sometimes can do the same thing. So if you have periodontal disease, it is important to have your whole family checked.
Fantastic. So what we call it as a mouth body connection, or what we call it as a kissing link. So think of this, guys. So periodontal disease or the gum disease, it is caused by the bacteria. It is a bacterial disease. So depending on the severity of the gum disease, you may have a little bit of bacteria or you have a ton of bacteria. So when you have a ton of bacteria, then it is easy for you to spread the disease and to your spouse and the significant other and your family. So if somebody has gum disease in your family, or your husband or the wife or the significant other, if you have a relation with them, it is absolutely critical for you to get checked
Absolutely.
for gum disease. Yeah. So again, if you're in the Dallas Fort Worth area, come see us. We'll be happy to help you. And this
Yes,
is
we
what
will.
we do day in and day out.
Absolutely. Um,